So my son is an intern in medicine in New Haven, and I said, well, what kind of patients do you see? He goes, well, typically, 50-year-old comes in, a couple grown kids, says I spend 3 to 4 hours a day sitting in the car. He complains of low energy. Doc interviews him some more and says, well, I don't exercise much. Weighs the guy, he's 28 pounds overweight, his blood pressure's too high, his glucose is too high, his cholesterol's too high, he's got signs of depression. So I said, Brendan, do you see any people like that? He goes, yeah, about 5 a day. This is the modern American. So a good doctor looks at all of this and sends the gentleman off for a meeting with a nutritionist, join a weight loss thing, do 10,000 steps a day, maybe meet with a social worker and get control over your life. Now, the insurance industry will pay for a $35,000 stomach stapling surgery, but it will not pay for 2 meetings with a nutritionist. But it will give you 1 meeting with the nutrition person and 1 meeting with the outpatient psychotherapist. And 2 months later, the gentleman's back to see his doctor and reports that my day is already too full. I don't have enough time to do the things I'm doing in my life. There's no time to exercise. There's no time to walk. And within 2 months after that, he is taking something for his cholesterol, something for his blood pressure, something for his depression. His wife has left him, and he's taking Viagra. And it's costing him $400 a month in medical care for basically life adjustment problems. Now, America confronted disease epidemics at the end of the 19th century. And people back then lived 35 years less than we did now. And the doctors pointed out that many of these diseases were preventable. The intestinal diseases that would kill children, the respiratory diseases that would kill older people. Those diseases began to go away not because of medical care, but because of changes in our environment. Clean water, clean food, clean workplaces, better homes, heating, central heating, and the rest. Oops. Ooh. One of the leaders in turning around or changing the view from a medical demand was one of my heroes in life. This man was born in Hartford, Connecticut. He created many of the places I love best in the United States of America. Central Park, the parks in New York, in Boston, in Buffalo, Montreal. The great, beautiful park that runs along the Los Angeles River for 100 miles with the carriageways and the green fields that you enjoy all the time. He was behind that. Actually, he designed it, but somehow business decided there wasn't enough money to be made, so instead they built that giant sluice that the Terminator rides up and down as our park for Los Angeles. This, of course, is Frederick Law Olmsted, the father of landscape architecture, but he's also a hero of public health. He was the man behind the much healthier hospitals that were put in place during the Civil War. He was head of the Sanitary Commission during the Civil War, Central Park in New York. So we're faced with a new set of epidemics. It's not intestinal diseases, it's not lung diseases, it's chronic diseases. These are highly prevalent in our population. Cancer, stroke, injuries, of course, are not chronic, diabetes, and the rest. These are diseases that are very expensive. They last a long time. And for these diseases, the patient is actually the doctor. They're in many ways related to lifestyle. I said that we improved our lifespans by 30 years. How many of those years do you think were due to medical care? 30% of the gross domestic product of the United States by 2030 will be medical care. Right now, it's close to 20% of the gross domestic product is going to medical care in one form or other. How many of the increased life years are due to medical care? 5. The other 25 come from the changing of our environment and creating healthier places for us to live, water, food, air, and the rest. So in 1999, I was one of the 11 center directors at CDC. In fact, Linda Rosenstock, the head of the public health school here, was the head of NIOSH, the Institute of Occupational Safety and Health then. And the head of CDC wanted to do a report for the Journal of the American Medical Association on the big threats to health in the 21st century. And so they called us in, and I'm driving over. I'm thinking about the big environmental health threats and parts per million and parts per billion. And Linda, of course, is thinking about occupational things, and the injury doc is thinking about the leading cause of death for young people being injuries. And I'm driving down this road, and you have roads like this in Los Angeles. It's called Buford Highway. It's where my office was, and it's 7 lanes wide. It's 2.5 miles between crosswalks. It's 2 and 3 stories of garden apartments on each side, mostly filled with poor people and immigrants. Highest injury death rate in the state of Georgia for pedestrians. And I look over to the right side, and there's a woman walking. She's struggling. About 95 degrees outside. I'm in a hurry. And she has a plastic shopping bag, one in each hand. She's in her 70s, and she's clearly having a very hard time. And I wanted to stop because she looked like my mom. And I just felt like I got to give her a ride. I didn't do it. I was going to this big, important meeting. So I go to the big, important meeting, and we're talking about big things, and I'm thinking the whole time, God, that poor woman, if she collapses from heat stroke, the doctors will write cause of death, heat stroke, and they won't write poor air quality, heat island effects, absence of trees, absence of public transportation. And if she's killed by a truck going by, the cause of death will be motor vehicle trauma, and it won't be absence of sidewalks, poor urban planning, failed political leadership. And in my career over and over again, what we do in public health is we're thinking about the causes of death, and it is inherently political when you start going upstream. At this meeting, we picked out the biggest causes of morbidity and mortality expected in the 21st century. There are 10 of them. Here are 4 of the big ones. Aging populations, overweight, the obesity epidemic, mental health issues, big environment issues. And one of the arguments I'm going to make tonight is we separate all of these and we think they're all separate disease disorders and problems, but in fact, they're whole cloth. They're essentially the same disorder. They're interwoven. They are syndemic, is the technical term. And in a way, you can't cure a systemic disease by treating each one of the symptoms individually. You have to think about the underlying causes of disease. And I'm going to argue that the underlying causes of disease is in many ways we're building our communities to work beautifully for cars and automobiles and machines and maybe even for business enterprise, but they're not working very well for people. Syndemic is a couple of epidemics working together at the same time, and they're being controlled by the built environment, the environment that we live. When we think about environment, we tend to think about things remote, far away, trees and birds and things out there, but we spend almost our entire lives, 99% of our time, in the built environment, which is the physical reality of someone's imagination. It's a concept. It's this way because someone imagined it this way before it was even built this way. And yet we don't realize that we're being so controlled by someone's imagination 20, 50, or even 200 years ago. By the way, what's the message of a building like this? You can drive in here and you not see a single neighbor. The car is clearly the most important aspect of this home. There's probably blank walls on the neighborly sides. And this is what we build all over America. So I was doing a talk like this in Northern California when I was health officer, and I was asked to be on a talk show in this. I'm sitting in the green room, and finally they call me into be on the talk show, and this guy that smells heavily of cigarettes and was big and red-faced says to me, "Oh, you're from public health. You must be in government. You must be either stupid or lazy or corrupt." And I said, "Well, I'm not corrupt and I'm not lazy, but sometimes I feel really stupid." But I started to talk about. He said, "Well, you really want to control people's lives because you're, a government public health person. Tell them not to smoke, not to do this, not to do that." I said, No. The purpose of public health is to create the conditions where people can be healthy. And that's really what we're talking about. How do we create conditions where people can be healthy? Not to order you to be healthy, but make those conditions. We have removed 60,000 square miles of photosynthesis in the United States. And we have paved it over with impervious surfaces that get hot in the sun and don't convert CO2 into oxygen. And then we have built houses further and further out, supported by highway funds and all the rest, and mortgage insurance. And shockingly enough, the less density that you have, the more people drive. We then have created the modern California state flower. These cost about $1 billion, and they are stopped within 5 years of being built. You just can't add more highways in time. When I lived in Atlanta, northeastern Atlanta did not want black people there, and Gwinnett County and Cherokee County, where Newt Gingrich and Bob Barr come from. And so they didn't put the public transit system in there. They just widened the highway and widened the highway and widened the highway. It's out to 23 lanes. It's stopped 5 hours a day, and now they want to widen it some more because the white people can't get back and forth to wherever they want to go. Well, when you pave over a landscape, you change the environment. So every time it rains, this is in my offices in Atlanta, every time it rained, the latex from the tires, the oil from the engine, the antifreeze from the radiator, the lead weights that balance the tires got ground up and ended up in the Chattahoochee River and the main drinking water supply for 5 million people, instead of percolating through the earth and being purified. So paving things over is an environmental health issue. It's a water issue. As you pave things over and you put blacktop, it gets 5 to 10 degrees hotter. If you put trees in there, it gets 4 degrees or more cooler. As it gets hotter, the ozone levels go up for 2 reasons. One is ozone goes up when it gets hot, but 2, the power plants put more, you need more electricity running. And when do you tell your kids to go out and exercise and play? Late in the afternoon, exactly the time that they shouldn't be. This is my son, Brendan. He was a good runner in high school and college. I'd tell him not to run at that time, and by the time he was a senior in college, he had developed asthma. This is a study right here in Los Angeles of kids that you would be very proud of, kids who played all 3 sports, fall, winter, and summer sports, 6 schools with high air pollution, 6 schools with low air pollution. If someone tells you air pollution doesn't matter to asthma, after 5 years, the young athletes that went off to school in the high air pollution areas had 3 times the asthma rates as the kids in the low air pollution areas. These are your neighbor's kids. As you build more and more, people drive more and more. We drive 7 times as many miles in the United States today as we did vehicle miles traveled as when I got my driver's permit. The number of deaths is exactly the same. It's about 45,000 a year. They've gone down in the sense of per mile, but they haven't changed much. I'm really having trouble here. Okay. What's interesting to me is that sprawl cities have considerably higher death rates from cars. Every man in this room, ladies, I got to tell you something. Every man in this room thinks he's a better than average driver, and that injuries will be less if he's driving, if we're driving. But every time you drive 66 miles, you have bought a 1 in a million lottery ticket for death. Average American thinks you're less safe living in an inner city area like Oakland, California, but in truth, the actuarial risk of someone commuting in from Modesto into Oakland is for dying in a pool of blood is higher for the person driving the distance than it would be for the urbanite living in the city. And by the way, when I talk in New York, the fastest growing counties in New York City are out in the Poconos, they're out in Pennsylvania. And people are commuting 100 miles each way. They've got 14,000 vacant properties, half of them not developed because they're brownfields. And if somebody actually built something there, there might be a 1 in a million lifetime risk of getting cancer, even though they're buying 2 lottery tickets of 1 in a million every single day they're doing the round-trip commute. So sprawl cities have higher death rates, cars are big killers, but pedestrians do a little better. See how the sprawl cities don't do so well? But of course this is phony because this is based on population. You can see that if you actually, why would the pedestrian death rate be so low in Texas? It's because they haven't invented pedestrians in Texas. So you can see the difference. If you don't build for people to walk, it doesn't happen. Now, there's only one thing. 71% of the people in the United States think the country's on the wrong direction, but 90% of us agree to one thing, which is that we're too fat. This is the rates of obesity in the United States based on telephone interviews. Less than 10% of Californians were obese in 1990, body mass index over 30. What do you think it was 5 years later? 15 and 19% of us obese. By 2000, 2004, 20 to 25% of us obese. Average Americans gained 25 pounds in the last 25 years. Average 11-year-old has gained 11 pounds in the last 11 years. I'm sorry, average 11-year-old has gained 11 pounds since about 1973. There are lots of causes. There are nutritional causes and the rest. When I was health officer, I interviewed for the job, and they said, what are your priorities? And I said, well, terrorism, preparedness, and this sort of thing, because it was 2004. My second priority was the obesity epidemic. And you can imagine the governor, his first thought was, well, your body is your own decision. I mean, he became Mr. Universe out of Austria because he made the decision to do this. But the argument I'm going to make is actually your body mass and your nutrition is being very much driven and decided by the environment that we are living in. So when we were trying to convince the governor to pay attention to the obesity epidemic, here are the rates of overweight amongst children less than 5. So these are kids over the 95th percentile, and about almost 15% of them over the 95th percentile. And for school-age kids, 22% of the kids in California were over the 95th percentile. We'd love to have the SATs at 22% over 95th percentile. But for obesity, it's quite worrisome. It's doubly worrisome because if you're overweight and chubby as a child, it's very hard to turn it around as an adult. These are patterns that are set up for your entire life. It's affected every aspect of our lives. When we were young, the typical ambulance was based on the Ford F-150, and then they had to go to the F350, so when it's an ambulance, it's an E350, has 4 tires in the back and can handle someone up to about 700 pounds or so. They're very expensive ambulances, by the way. And you can imagine that the gurneys and the cots that are used to move people with these same ailments are extremely expensive. I'm not saying this to make fun of individuals, but I am saying it to say that there are indirect aspects to the obesity epidemic that you never would have dreamed of. One day I was thinking, gee, with all the people getting on airplanes and burning jet fuel, I wonder what happens. Everybody's gained 10 pounds in 10 years. How much additional jet fuel is that? So figured out, multiplied all the miles traveled by 10 pounds, and it came out to $1 billion worth of jet fuel. It's the only study I ever did that was cited by Jay Leno, who said, now I know why they don't feed us on airplanes anymore. And so after we did our study, this fellow did one, and for cars, we use $1 billion gallons of gasoline more every single year because we're transporting our excess adiposity around the landscape. I asked my son when he was a medical student how his surgical rotation was, and he said, I hate it. I said, why? He goes, all I do is hold cameras and retractors for stomach stapling surgery. They're just rolling one after another in. It's like 8 times the numbers they were even 5, 6 years ago of these surgeries. You have to have body mass index over 35. Very expensive, and you don't need to be an epidemiologist to look at this and go, that's an epidemic. Then you see something increasing at that kind of rate. Dramatic change in our healthcare costs. If I become obese, I raise my risk of stroke, of high blood pressure, of heart disease, of liver disease, of gallbladder disease, of joint disease, if I were a woman, of having a baby with a birth defect, and worst of all, of becoming diabetic. Only technical slide in the whole talk, but it's an important one. We like to see us down here. Body mass index under 25. Doesn't raise your risk of dying sooner and doesn't increase your risk of becoming diabetic. You're overweight if you're in this range, and my risk of becoming diabetic is 4 times higher than it would be if I were down here. If I were a woman, it would be 16 times higher. If I start getting into the range where I'm obese, I'd be about 20 times more likely, but a woman would be 50 times. And if I'm in the range where I qualify for stomach stapling surgery under insurance requirements, 40 times higher risk for a man, almost 100 times higher risk for a woman. Do you think that with this obesity change that I've been talking about, the obesity change, would you expect that diabetes rates would go up at the same time nationally? So here's 93, 94. Here's California at what, 4 to 8%? I can't tell the color from here. Here we are in 1999, 8 to 10% of Californians. 2001, the yellow is over 12% of the population. So we've doubled the percentage of our population with diabetes. We now spend 1.5% of the gross domestic product of the United States on diabetes alone. When I was a young pediatrician and I'd work in the pediatric clinic, the diabetes clinic, we'd see kids with juvenile diabetes, the insulin-related one, but we wouldn't see adult onset diabetes. That's what we called it, because it was related to too much weight. It is now thought that about 1/3 of all of our diabetic children are adult onset diabetes. When you work in the transplant ward, the 5th reason for someone needing a transplant, kidney transplant, was diabetes. It's now far and away the 1st reason. So when someone has, we're going to do a big campaign to have donor organs and the rest, I think it's great, but the best thing you could do for, donor organs is actually to reduce the rate of diabetes in our population, and it would have a huge benefit as well. Just a sad story, but a whole new industry is growing up because more and more people are losing their limbs. I talked about interviewing for the job as health officer and being questioned why was obesity such a big problem. And this is the slide that really got the attention of the governor and the staff and Mrs. Shriver. At the rate we are going, 1/3 of our kids will be diabetic in their lifetime. Average reduction in lifespan by 15 years. Average reduction in the quality of life by 20 years. Your quality of life, if you're on dialysis and have gangrene of the feet, is not very good. Huge costs associated with this. And totally preventable. Or not totally, but substantially preventable. Fitness is important. I was not taught this in medical school. This is I was taught obesity was bad for me, but they just never talked much about fitness. This is a study of 100,000 nurses that was begun in the early 1970s out of Harvard and followed for the next 30 years. In fact, some of the people in this room will probably fill out questionnaires every year, and when we die, the certificates will be checked as cause of death. The nurses who stayed thin and fit had a standardized death rate, but the nurses who became obese had a 90% increase in their death rate, people just like us. What happened to the nurses who stayed thin but became unfit? Did they have a higher death rate? 60% higher. And the nurses who became unfit and obese, 2.5 times the death rate. Why am I showing this? Because losing fitness is a matter of life or death. Removing exercise from our lives is a matter of life or death. So what have we done with our kids? Are they nice and fit? When I was health officer, there was this whole debate about do we put the body mass index, the BMI, on the report card. And I thought that was stigmatizing. I did not think that was a good thing to do. But I think the fitness gram is a fair thing to do. Can you do this stretch? Can you do this many sit-ups? Can you run a mile in 12 minutes? 3/4 of the kids in California can't pass a simple fitness gram. Can't run a mile in 12, walk a mile in 12 minutes. 3/4 of them. 2 out of 7 military volunteers in California now are flunked because of either obesity or lack of fitness. 2 out of 7. Just dramatic changes. If you visit Europe and you get off the plane, you're walking around Amsterdam or Northern Europe somewhere, and you look around and you say, these people look great. And then you get back home, you land in Atlanta or someplace, and you look around and you go, God, Americans are really fat. I mean, you know, we are. This is how much they walk or bike for simple trips. About 40–50% of all their trips go buy a carton of milk or a newspaper, 40–50%. What do you think it is in the United States? 7% of our trips walked or biked. Why did I put this here? Because this incidental exercise in our lives, you know, it's not, you know, you're not going to the gym and working out, but it's really important exercise, the incidental exercise. And it doesn't matter when you do your 10,000 steps, we just have to do them. Now, we do everything we can. We do everything we can. You know, this poor dog's trying hard to help this guy, but you know. And a lot of us think if you join a club, that's really valuable exercise because you're paying $80 a month or $100 a month to get this exercise. You know, and you know they're getting on the step machine when they get in there. Suppose, I see Kaufman Broad's building out here in KB Homes. We build an awful lot of stuff that looks just like this as we pave over the landscape of the United States. Suppose you're 8 years old, you live in this house right here, and you want to get together with your friend way up there. And you call up and you instant message, let's get together. Oh yeah, come on over. Well, you know, you can climb over the fence and pass the Doberman and the Rottweiler and the pervert and the guy with the gun and go to your friend's house, or you can get on your little bike and you can bicycle for 3.5 miles all the way around to your friend's house. And by the way, there are probably 1 million kids in the United States who live 200 yards from a school and cannot walk to it because of the way we design what we design. This has an effect on the quality of our lives. Every woman in this room, average American woman, drives twice as much as her mother did, and at the rate we're going, every one of your daughters will drive twice as much as you did. And parents are spending more and more time being chauffeurs for their children, taking them absolutely everywhere. This is a technical slide, but the simple version of it is that my friend Larry Frank and co-author did a study where they put accelerometers and GPS things on people, and white people and black people and males and females, and they discovered the more time you spend in the car, the more likely you are to be obese. Proven. So how important is food in all this? I'll just touch on it a little bit. We have changed the American diet. This is an absolute bargain, right? You get almost a day's worth of calories for about, $2, $2.50. Where are the fast food restaurants? A lot more in the poor neighborhoods than the rich neighborhoods because the rich people don't want them right there in their neighborhood, at least not the way they look and with the litter around them. So let's say you take your grandchild down to the restaurant, in the fast food restaurant, and they say, supersize that? And you say, oh, well, 67 cents more and I get 73% more calories. That's a bargain. Actually, every time you supersize, you add 1 ounce of fat to your body. On a man, it's here. On a woman, it's here. But it's 1 ounce of fat. Good news, ladies, is it's only $3 for that ounce of fat in healthcare costs for a woman and $6 for a man. Not a bargain. We've changed our diets. Look, girls need calcium, by the way. Boys do too, but the girls especially need calcium and iron in their diet. Amount of milk being consumed by girls has declined dramatically over time. Soft drinks have gone up. And how much sugar is in a 20-ounce soda? It is 17 teaspoons. If your little niece had got to 2 teaspoons on the Cheerios, you'd tell her to stop, right? 17 teaspoons in one drink, and their kids drinking 3 and 4 of these a day. 250 calories. You can burn it off. You can go play basketball really hard for 40 minutes, and you can burn off 1 soda. So this is my nephew, Jack. I'm very proud. He's a neat kid. I went over to the family's house for Easter dinner last year, and he wanted to go skateboarding. We took him up to the skateboard park, and he comes in. I'm talking to his dad. Uncle Dick. Yeah, Jack. Uncle Dick, I gave up high fructose corn sugar for Lent. Really, Jack, I didn't know you knew what that was. How was it? He goes, it was really hard. I went to the 7-Eleven and looked for 3 hours. And the only thing I could eat was sweethearts. And he walks and bikes to school. So are kids getting fat and not exercising? Well, that's something morally and physically wrong with them. They're inferior creatures, right? No, of course not. We've created an environment that makes it impossible for them. Our kids are watching twice as many ads, and many of them are food ads, as the kids of a generation ago. When you were in school, you were told this is the food pyramid, eat a little bit of the fats, oils, and sweets at the top, and eat a lot of the stuff at the bottom of the rice and grains. What do you think is advertised on television? Do you think it looks like that? There's the real food pyramid that children are educated to. So Governor Schwarzenegger brought in a bunch of 25 of the most influential people around the obesity epidemic, and there are people from Coke and Pepsi and all the rest. And somebody was arguing that, if we just exercised more, we could burn off all this high fructose corn sugar. And I got out my BlackBerry and I'm tapping in 63 pounds, and I'm calculating up 63 pounds, the average consumption of high fructose corn sugar in the United States, 115,000 calories. I was back of the envelope calculation, but that's 28 pounds of body fat just on our average allocation of high fructose corn sugar in the United States. You can burn it off, they're right. You can buy a Geekosile, put it in your office, and pedal for 318 hours a year, and you can burn off our high fructose corn sugar allocation. It's absurd, of course, but it's absurd to be feeding, particularly since the brain doesn't recognize fructose the way it recognizes other things. We've then taken our children's legs away from them. We've reduced the number of schools in the United States 5-fold, and we've made them many-fold bigger. How many of you walked or biked to school as a kid? How many of you have children or grandchildren that walk or bike to school? Look around quickly. Yeah, it's hardly anyone. About from 100 down to about maybe 10, 12 people. And these are the actual numbers from 1974 to 2000. About a 6-fold decrease in kids walking and biking. So what, right? Is that important? Kids who walk and bike to school learn better, behave better. Get this, they're more active than the kids who sat in the car on their way to school. And you know what? If we had safe routes to schools, and there were more moms and dads walking around out there, everybody'd feel safer about it, and maybe a police officer ought to go by on a mountain bike once in a while and check things out, and people ought to get there and know their neighbor, and maybe mom and dad lose some weight at the same time of getting to know the neighborhood. And our worst traffic jams are around schools. And the worst driving, by the way, I think. And Richard Louv has written some wonderful articles about the removal of children from contact from nature, and the removal of just the free time. How many of you, when you were, I was a baby boomer kid, you got up on Saturday morning, you went out of the house, and the only rule was you had to be home before it got dark. And I think that removal of autonomy from our lives, from children's lives, is really a significant thing. So think about the modern American child. Gets in a box on the way to school, is in a box at school. They've gotten rid of anything that the really good stuff in school, music, art, and PE, because it costs too much money. I'm not joking. They sit in the box. They've gotten rid of recess because they got to make no child left behind requirements. They eat standing up in the hallways because the cafeteria has been turned into a classroom. They spend the afternoon in the classroom. They get back in the bus, ride home in the box, get in the box, turn on the box, and then we wonder why kids are hyperactive and consuming Ritalin. Every mother in this room knows that kids are more likable if they have a chance to run around and play. That's the sales of Ritalin in the United States over the last 20 years compared to the rest of the country, rest of the world, I'm sorry. Where do kids learn better, big schools or small schools? Small schools. Where are they happier? Small. Where are the teachers happier? Small. And yet we build bigger and bigger and bigger because it's all about money. And by the way, the people transporting back and forth in the cars, that's a cost that the school isn't bearing in the school district and the tax system. Bill Gates and Melinda.
Huh? It's
It is about fairness.
Even the big schools are complaining that the ones in the little schools have an unfair advantage. So get rid of the little schools. That was the argument in Nebraska.
Well, all I know is that kids are a lot happier in small schools. I think the effort to go back to school garden, or to have school gardens in every school, makes sense. Lincoln, California now has a school garden run by the middle school and high school kids that supply all the food for the entire school district at this point. It's meaningful work. Berkeley has its school gardens. Alice Waters had a lot to do with it, but the food tastes good and the grandparents are right there participating in the preparation. This relates to the global environment, the CO2 level increase. I'm not going to stay with this one very long because I'm running out of time. Sorry, I'm going to skip these. We are beyond peak oil at this point. We are depending upon our fuel from unstable parts of the world. We are raising the CO2 levels of the planet. I don't care what your politics are, that there is a direct relationship between the CO2 levels in the atmosphere and the temperature of the planet. It does go up as a result. So where do we go from here? We're going to create conditions where people can be healthy. We were faced with an insurmountable challenge in 1950. Doctors were advertising that people ought to smoke. We couldn't turn this around. California put in place 3 big interventions for tobacco that were remarkably successful. California is the blue one. We taxed cigarettes. Maybe we ought to tax other things. We demonized the tobacco industry. We used the tax dollars to do that. It was the most politically difficult thing that I probably had to deal with because the tobacco industry was so powerful. And we made it illegal to smoke in public spaces. And that had a huge intervention. Do you think that lung cancer went down because of the California experiment here? Look at this. 21%. Look at the difference between California and the rest of the United States. Everybody my age in this room has lost loved ones to lung cancer or throat cancer. And to see a 21% decrease because of these interventions. Public health really works. You got to turn down all the dials, but public health works. So turning around the obesity epidemic, one is we've got to rethink the American diet. The guy that did the nurses study is Walt Willett. He's been working with the CIA to change the American diet. They train 10,000 chefs a year to move to a diet that's low in meat, low in fat, and higher in fruits and vegetables. And the CIA has also... Actually, they were the CIA long before the CIA was the CIA. But the larger point is, if you want people to change their behavior, it's got to be pleasant and attractive, and it tastes good. This is my Secret Service picture, my wife calls it. And, but think about California. Its major production, one of the most profitable things we do is we produce food, and with climate change and heating, it's going to be harder and harder. And why are we importing food from other parts of the world and then paving over the prime landscape in the Central Valley? What do you think the leading agricultural county in the United States of America was in 1945? L.A. Absolutely right. Leading agricultural county both in quantity, but also in profit. You know, how much do we produce now? It's a tragedy. Remember how we demonized tobacco? Well, we need to demonize bad food. And food spelled backwards is doof. And so everybody in America needs to know if you eat too much doof, you become a doofus. We need to tax high fructose corn sugar. If we taxed high fructose corn sugar in California, it would raise $2.1 billion a year. I wouldn't use 1 cent of it on stomach stapling surgery. I'd use it on PE programs and maybe supporting good nutrition programs and educating teachers and farmers markets in poor communities and school gardens and local community gardens and the rest. Maybe after we get done with all the preventive stuff, we'll find a little money for the remediation surgery. But we need in America, and this is my strongest public health message, we need to spend the first dollars on prevention, not the last dollars on prevention. So I was health officer and began to argue a lot for farmers markets. Dick, there's no evidence that people are healthier with farmers markets. You know, and I can imagine that if everybody went to a farmer's market twice a week and mainly ate fruits and vegetables, maybe their blood pressure would go down by 2 points and their weight would go down by 3 points. And maybe they'd smile a bit more because everybody's happy walking through the flowers in the farmer's market. But I really can't prove you'd be healthier, but it's okay, you know? Anyway, we had this big pressure, and we finally got the WIC cards and the food stamps to be accepted in farmers markets, which sounds rather bureaucratic, but it's very important for poor people because generally the neighborhood grocery store's got Twinkies and beer and that's about it. And so this is really important. We've got to build communities where people can do their 10,000 steps a day. So the National Institutes of Health was doing a study of what was the best drug for diabetes, pre-diabetic people. They looked at drug A and drug B, and my friend Jim Marks convinced them to look at walking as drug C. Oh, that's stupid, you know. They did drug C anyway, walking. At the end of 6 months, drug A didn't work very well and had complications. Drug B was fen-phen, they got rid of that. And I'm not kidding. And drug C was walking 10,000 steps a day, 3,000 women. At the end of 6 months, they had lost 6% of their body weight, and their blood sugar had dropped to normal. They weren't going to lose their eyes, their kidneys, and their feet to diabetes. No other drug works as well as building exercise and walking back into our lives. If you're already diabetic in an audience like this, somebody would be, the best thing you can do. Your survival doubles if you become fit and stay fit. Not all of our weight gain is due to community design. It's probably about 6 pounds, 6, 7 pounds, but if everybody lost 6 or 7 pounds,